Recording in progress.
Welcome, everybody, back to the show. This is The Broken Brain, and I am your host, Dwight, here again with you to talk about the different ways in which psychology is interacting with our lives and intersecting with our culture, and in this case today, especially with our health. Big focus, obviously. Health is a crazy thing, isn't it? But we're always chasing after better health and trying to understand how our health works, and the elements and the part that psychology plays in that. And you can only imagine my excitement when I saw in our guest today's biography the description of a behavioral cardiologist, amongst many other things that you've done. That was in there, and I thought, okay, this is exactly right up the alley of the things we try to amplify here on the show, which is that psychology is medical. It's not off on its own. It is involved in our medical and health-related life. And so that alone made me very, very excited. My guest today is Dr. Alan Rozanski, who is he's a professor of medicine at the Icahn School of Medicine at Mount Sinai. Did I say Icahn right?
Icahn.
Icahn. I remember to ask about names, but not names of places and organizations. But you've developed a lot of health psychology and psychological information going into health management, and also, and I'm sure we'll get into this too, but have developed a model of health management known as the 6 domains of health as well, and very excited to get into those. But Dr. Rozanski, thank you for joining me today.
It's my pleasure to be here. Thank you for having me.
Well, I like to start out with having people tell everybody a little bit more about themselves, kind of from their own perspective. What led you to get involved in medicine and to take this approach? And, a little bit about who are you?
Sure. Well, my dad was on a pedestal. He was a doctor, so I was going to be a doctor by the time I was 10. And I was going to go into private practice, and I trained as a internist and a cardiologist, and then became an imaging cardiologist. So on the way to, it was that movie called, Something Happened on the Way to the Forum or something like that.
That was it. Yes. Something happened on the way to the forum.
Yeah, it was a great movie. So what happened was I went out to Cedars-Sinai Medical Center. I trained at Mount Sinai to do cardiac imaging and got very involved in all these technical areas. How do we image the heart better? And particularly when patients exercise. Because what happens is if you want to detect people having heart disease, one of the ways we can do this non-invasively is put them on a bike, for example, and look at the wall motion of the heart. And if they have normal arteries to the heart, all the walls start moving better and faster with exercise. But if you have a blockage in one of your coronary arteries, then it begins to slow down in that particular area where the arteries are blocked. So that's what we do to evaluate patients. Well, for reasons that I could explain, I came up with a project where we wanted to see what happens to the heart during mental stress. And I wasn't really interested so much in the mental stress. I just wanted to know more about the physiology of what causes the heart to not function well. But for this project, we came up with a few different kinds of mental tasks, one of which we asked patients to speak about the stress that they were having in their lives. So the second patient we're doing was a 59-year-old man who was about to lose his job. And he's talking about this stress he's having. And we're looking at his heart function while he's talking, just merely talking about the stress. And nearly half of his heart stopped moving while he was just talking about the stress. So that was my aha moment. This happened back in the 1980s. And I couldn't walk away from that. So slowly I began to study, what else is affecting the heart? And one thing led to the next. And that's how I became eventually a behavioral cardiologist.
Yes. I find it funny working in the field of therapy, and even amongst therapists and psychiatrists and clinics and places that I've worked in. I'll be sitting in case staffings and I'll hear this phrase, and it grates on me. Everybody who knows me knows that I hate this kind of phrase. They will say things like, so we're trying to figure out, is this problem medical or is it psychological? And I'm always like, I get what they're trying to say, but we need a better way to say that. Because when we say that, we're saying like, well, here's the mind mysteriously way over in some other nation, country, world, universe. And here's the body, and that's over here, and that we all know. I mean, let alone the fact that patients are used to when they hear something like that, they think, oh, what you're saying is it real or not? But then amongst even clinicians that will say things as if it's like, oh, this is some kind of, but the brain is contained inside our body. I'm not a doctor, of course. You are. You can critique my assessment there, but the brain is contained inside the body, obviously, and so it makes sense that everything is hooked up to each other, right, at the very base level.
Absolutely, absolutely. You're getting at the essence of the issue. This is what I have called for years the artificial divide. When you look at the brain and you look at the body, it's bidirectional. So we know, for example, that when people have any, let's say they're depressed or they're pessimistic or they're lonely and so forth, then they have worse health habits. And these habits start to affect the brain. So what happens is if you look at people who exercise, for example, they have the effects on brain in terms of biological are great, in terms of more neurogenesis and neuroplasticity and so forth. But also when you exercise, it has a profound effect on how you feel. And in fact, we've learned that exercise functions essentially as an antidepressant. So you have this bidirectional relationship. So how we eat and how we exercise and our sleeping habits affect our brain, and our thinking affects how, it affects our physical health. We have much evidence of that.
As you were talking about this first case where you started to notice this, I'm thinking, you said the heart functionality, you said about half the heart shuts down just while he's discussing this life stressor that he's going through. And man, so that hits me with a few questions right there. So if we extrapolate that to people, right, and if we're having, first of all, I'm assuming there's been lots of research since the 80s to say, do we notice that to be pretty typical? And then also, how much is that happening when we don't happen to be strapped up to a monitor, if we're going around thinking and talking and worrying about these stressors all the time?
Yeah. Well, that's a great question. And I'm glad you brought that up. Let me put this in context. So this patient's particular response was quite profound. Although in half the patients with heart disease in that particular study, we found that during speaking about the stress, this particular phenomenon occurred. And this has been reproduced in about 15 to 20 medical studies, by the way. But clearly what happened in this case was a person who had very significant heart disease. If I take the average normal person and put them through this thing, nothing's going to happen in terms of their heart. You'll just stimulate the whole body in terms of, catecholamine response and so forth. So that's number one. Number two, fortunately, we have transitioned where heart disease in general is a milder disease today than it was 40 years ago. We don't see the amount of people who have severe chest pain. When people have heart attacks today, they're milder in degree. And this is due to many factors. We've brought down the cholesterol levels in society. We have great medications. We detect heart disease earlier. So we see this kind of response earlier. We take disease earlier, so it's not as severe as what I mean to say. So putting all that in context, for 3 or 4 years, I was studying the effects of acute stress on the heart. But slowly I began to look at something much broader, which was what was the effect of chronic forms of stress on the overall health of people, including the brain and so forth. And one of the early areas that I got involved in was the role of depression in terms of its effect on the body. So when you have people who are depressed for a period of time, every physiological system of the body goes haywire. People have a greater risk of insulin resistance, osteoporosis. They develop effects on the brain in terms of an enlargement of the amygdala and in terms of actual shrinkage of the hippocampus and prefrontal cortex. So this relationship between our moods and our feelings and our brain are quite profound.
So then there is I think we think of heart health, sometimes all facets of health the same way. We focus on it as a reactive strategies, lots of reactive. I had a heart attack, so I better go talk to somebody, or I'm having problems or whatever. As you mentioned, there's a lot more proactive detection nowadays, but you're kind of, it sounds like the studies and things you're talking about are like, how does this affect us before we know that we need to walk into a cardiologist's office? Is this part of it? Is like that proactive, what is our health management?
Sure. So there's two thoughts that come to mind as you say that. The first is that in terms of detection of disease, we now have methods like one is called coronary artery calcium scanning, where we can simply put the patient under a camera, which will detect within seconds if there's any calcium deposits in the coronary arteries. And this is a way of detecting heart disease 20 years before someone might have gotten a heart attack.
Gotcha.
And then there's a way to, then intervene and get people's cholesterol level down and make sure that they're exercising. So that's one aspect of it. But there's a bigger, more profound aspect, which is what you actually said in the beginning of your introduction here, that health is a bit of a crazy thing. And the problem that I think is the bigger problem is what do we mean by health? And actually, I've asked this question of many people, not just doctors, whatever. And people, when they're not asking for a definition, there's either a smile or something. And people intuitively understand that health is more than just the absence of disease. But what is it really? So really, health is, not just the absence of disease, but that sense of feeling a high sense of vitality, feeling, energetic. And it's a pleasurable sensation, which we take totally for granted, except when you have like a cold, or actually you get older, or you have illness and you actually start to deal with fatigue. Mm-hmm. You say, oh, wait, I remember how I used to feel energetic. And then it becomes very precious to me. But the point is that we can have greater degrees of vitality by, the quality of our thinking, by our, health habits, and so forth. And that's not to wait to come to a doctor in a reactive mode once you've developed, a hypertension or you've developed, heart disease or so forth. But really, how can I be more vital and what can I do to be more energetic in my life? So that's how I think of health, something way before you need to see a doctor and maybe, putting off needing to see a doctor for decades to come.
Mm-hmm. How do you feel like we do at that kind of overall societally? I think that's an ongoing struggle, right? Even just getting people to think about, as you put it, there's the take it for granted part. And then there's also all kinds of other layers of obstacles there. Of course, access to care, knowing that we should, who to listen to, all that jazz.
Well, I don't think we're doing as well as we can. I would put it that way. We have, if you look back to the 1930s, go all the way back then to today, we're living 20 years longer than we did in the 1930s, which is an amazing gift. Back to the 70s, maybe 10 years longer. So that's an incredible gift. And we see so many people today being very active in their 80s and even early 90s, and we're not shocked by it anymore. And that's great. But the fact is that when we look and when people start developing medical illnesses and conditions and so forth, by the age of 65, you have the majority of Americans having 2 or more medical conditions, and yet facing, at least in terms of average longevity, if you've made it to 65, almost 20 more years of, of life. But now you're entering these golden years with a higher burden of illness than you should if you would just do the right things, which is exercise and proper nutrition. But much more than that, it's about, also attending to all of these psychological aspects that you talk about.
Mm-hmm.
In fact, go ahead. Well, I was just going to point out, if you look at all of these domains of health, and I really talk about 6 of them, which is, just not your physical health, but the quality of your emotions, the quality of your thinking, the quality of your social life, your sense of purpose, and how you manage stress. And I say these are 6 domains because in each of those domains, the body testifies that if you're doing well in those domains, you're going to have better health, live longer. It's heart disease. And the opposite's true if, let's say, you're pessimistic and lonely and so forth. So these are legitimate domains. But what's interesting is that in each of those domains, the data is very strong that if you're pessimistic, lonely, and so forth, you're going to have poorer health habits. It's just so. So you see this, again, bidirectionality between how we're doing in terms of our emotions and in terms of our sense of life purpose and so forth. So I say, wait, the pathways to being one of those people who are going to live longer, well, is all these factors that actually promote a better life in general. Mm-hmm. And in that sense, if you're living, the good life, so to speak, health is a byproduct of just pursuing, a sense of meaning, a sense of purpose, a vibrant social life and so forth.
Yeah. It's no, it's very powerful how we don't, once again, we get into crisis-based thinking and psychological therapies and stuff. We talk and focus a lot on avoiding, suicide as an outcome, for example. But then once again, do we remember that that's not enough to just, life is not the absence of death. Just like you said, health is not just the absence of sickness. And then we might be a little more like, okay, quality of life in a reactive way. But you're talking about really trying to actually say, what are the things that contribute, right? That are just kind of creating that life and a sense of something that you want to hang on to. That's what I'm getting from your definition of health. It's like, no, I want to experience this. And I want to keep it, even if I'm experiencing it, that it becomes part of a way of life. Let's get into that. Then the 6 domains of health. What are those? Can you share those with us?
Sure. Well, in the physical area, and I think that's where I'm going to start as a cardiologist, is I say there are 4 pillars of physical health, which is exercise, resistance training, sleep, and proper nutrition. So the biggest question I asked there is, well, why are you separating out resistance training from exercise? And I do that because exercise, just being physically active, just by doing more, immediately you're promoting your health. And you can make it fun, and you can figure out things to do. And here, people don't like to hear this, in terms of there's a book actually written called No Sweat, and it's really a great book by Michelle Segar, and she points out that we keep talking to people in terms of future benefits of exercise, but people will then put that off till mañana. I got other things to do. I want to exercise, but I'll put it off till tomorrow. So our whole philosophy there is find ways to make being physically active more fun. But resistance training is a whole different ballgame, because there it is no pain, no gain. You have to really work out your muscles and so forth. And we've done a poor job of getting, the community to do that. And one of the things that's going to determine your quality of life when you're in your 70s, 80s, and 90s is where you're actually working out all the different muscles of your body. You're doing the squats, the planks, all that kind of stuff. So first of all, there's a lack of know-how. There's a lack of medical help for that. And, there's a lot of instruction that has to go into place. So I put that as a physical domain of physical health. Mm-hmm. So there's your 4 pillars of physical health. Do those 4 things, and you will decrease your incidence, and don't smoke. You'll decrease your incidence of chronic disease, according to the data, by at least 70%, which is quite profound.
Wow. And that is interesting when you put it that way. So resistance training or resistance-based exercise is definitely where people would want to look for that kind of thing. I heard I don't know, a colleague of mine who was big into the health psychology more used to say, you at some point you hopefully where our mind shifts away from what we're taught about exercise. A lot of times is it's about appearance. It's about social norms and things like that, of how do you look and can you attract a date or whatever. And it's hopefully at some point we cross the line where it's like, I'm really looking forward to being able to go for a walk or get up and down out of a chair, and or little things that we do. I'm really looking forward to being able to do those when I'm very old, without it being a huge burden to be able to walk across the room. And we don't always think about it that way, especially maybe when we are under a certain age. Maybe I'm not sure what that number is, but yeah.
Well, first of all, in terms of reasons for exercise, there's never one size that fits all. And if you want to do it because you want a better appearance, I think that's perfectly fine. If that's important to you and that's your why, that's fine. But I think the problem that where we fall down in all of this is we keep, as physicians, emphasizing the future benefits of exercise, which are quite profound. Less incidence of heart disease, a lower risk of dementia, lower risk of diabetes, etc. But the problem is that, particularly our hustle culture today, is like, I'm so busy, and that's important for the future, but it's, in Stephen Covey's book, The Seven Habits, talks about 4 quadrants of time. And the place we don't get to is those things which are important but not urgent. And when we phrase exercise as something important for the future, we put it in that quadrant where it is susceptible to just procrastination. I'll get to it eventually. What we really need to do is emphasize the present benefits of exercise. You actually feel more energetic. The data shows that you think better, you're more creative, you have a lower risk of depression, you feel good, and that's what I think what we need to emphasize. And also that you can get this in bits and pieces. There's newer guidelines for exercise that even most physicians don't know well enough, that shows any amount of physical activity, even done in bits of 5 minutes or so, help promote health. So it's a matter of almost being a game during the day. How can I, figure out ways to get a little bit more exercise? Maybe take the stairs instead of the escalators or the elevators, and you can actually make a game out of it and actually get your exercise needs met if you don't have the time. Otherwise, of course, aerobic exercise, if you're doing more, there's additional benefit.
Sure.
But I'm just going to get a lot of it just by, creating what I'd call a lifestyle exercise.
Yeah, I read somewhere a long time ago, that it was the vast majority of people really will never consistently go to like a gym or something like that because most people, once again, on average, the majority of people don't enjoy going to a gym. That they think they should do it, and that there is a subset of people who really do enjoy it or something about it, that activity, they like it. But then I think sometimes that's where we feel left behind. If I don't do that, then I'm just too lazy to be healthy. But you're talking about a whole different mindset about just being active as part of the process, and the benefit too, I guess, is the being active.
Yeah. Well, there's something magical about the gym. The fact is, let's say resistance training, you can do it all with bands and body weight. You don't have to go to the gym. But there is something magical about a gym because you walk in there, you feel the energy, you feel this is a culture, that you want to be part of. And it plays an important part for many people. I do think I'm seeing more gyms and more people, attuned to that. I don't know the stats on it, but, but it's powerful because of the social aspect of it.
But I like how you throw that in there to say, yes, it's good. Both sides of that feedback are, I think, really good for people. So, even increasing exercise wherever you can just by physical motion, but then not neglecting the fact that if you want the benefits, you're going to have some focused resistance-based training of one kind or another. Other than just people who know a lot or friends who go to the gym or something, where do people, would you say, is a good place to educate themselves about resistance-based exercise?
That's a great question. You do have to find someone who's got know-how. And, one of my children, he has figured this all out just by, using, looking at what's available on YouTube and things like that, and talking to some friends. And I go to him for advice. I mean, so you can gain advice different places, but, getting a trainer, if you can afford it, is a very powerful and useful thing to do. But, there's no one size that fits all in this respect as well. But many, many more resources are available today, 10, 20 years ago by far.
Absolutely. Yeah.
Exciting area. And then also I would point out one other thing about it, because people have this notion, I got to go to the gym to work out, or I need, to spend that time. You can break that up into small parts here. You can have 5 minutes of, resistance training in the morning and the evening, and then work out different muscles the next day. So you can break that up. And I think that's another area that's not emphasized enough, that kind of strategy.
I think our definition of what is and isn't success also, right? Like I say, and as you put it, if someone enjoys there's an aesthetic to how I look and all this kind of thing, there's nothing wrong with that. But when we look at it as if I don't go and get this observable result, or if I don't go and I'm all of a sudden doing these kinds of events or competitions, or however we compare, and that instead of comparing it to increasing our own health and what we want to get out of it, we maybe compare to other people that we see around us, or even worse, the vague societal goals of what success means, then we don't even do those 5 minutes, like you said, because we're not recognizing that that's not what we're competing for, right? Yeah.
You're absolutely right. If you look at the data, about a third of Americans get no physical exercise at all. And it's correct to say that that's like the equivalent of smoking. That's how profound that is. So I say that the key thing is in anything, take like a rocket going off. Where's the greatest amount of stress in the initial takeoff, right? That's where you need the most energy. So changing from no physical activity to something, that's the barrier we have to cross. So I say the key thing is to get on the playing field. So I start with the patient who's sedentary, and I said, can you give me 5 minutes of walking per day, intentional walking? And so often they'll say, yeah, sure, doc, that's not a big deal. But it is a big deal.
Yeah.
And many fail to do that. And that's the human condition. And so that's the barrier to cross. Just can you make sure you're doing 5 minutes a day? Once you've done that, you know what? There's going to be a day you walk 10 minutes. There's going to be a day you run into a friend and walk 20 minutes. And then it goes. And it goes. It's just that initial start.
Yeah.
We say that's easy. It's not easy.
No, exactly. Yeah. And then we beat ourselves up for not doing it because of the belief that it's easy. It's so easy and I didn't do it. What's wrong with me? Kind of a thing.
We have to be more compassionate with ourselves. That's the human condition.
Well, tell it. So that leaves us. Those are the first four that focus on the real physiological, practical, like realities in that way. Where do we go from there for the domains?
Then I go immediately to what I call mental vitality, which is a combination of the quality of your thinking and also, the things you can think about. The brain is a muscle. It's not a muscle. It's all these neurons and so forth, but we should treat it like a muscle. In other words, that we need rest. We need brain thrives on variety, changing from one focus to another. And you have to play with that. And then you have to think about, well, gee, if I'm going anywhere, I'm going on vacation, I'm going out with friends, I'm going, anything you're going to do, what's going to determine the quality of your experience at the moment? Your thoughts and your feelings. And your feelings derive largely from your thoughts. So wait a second. So how about, making sure that I'm living with a great repertoire of great thoughts and so forth. So we again can look at the body and say, what does the body teach us about what are, those right thoughts to have? So it's not so easy to study because it's not as easy to measure. But one of the areas that we've studied tremendously because we have a good measure of it is people's level of optimism versus pessimism. And the data is quite profound. It's been very consistent in terms of looking at younger people, older people across continents. The people who are optimistic actually do live longer. They have less heart disease. They feel better. And so it's telling you, wait, how can I be more optimistic? So we could talk about that. But then you can extend that and say, well, what are other mindsets? And one that's more accessible, but we just take for lip service is your sense of gratitude. So you can work on that. We can develop exercises. It turns out there's data that suggests that people who are more forgiving as opposed to people who hold on to resentment actually have better physical health. And it's also true if you look at people who have a lot of anger and hostility versus people who are more Teflon and let things bounce off. So these are all areas to take in. So you say, well, these are whole areas that you could talk, in terms of 2 or 3 podcasts. How do you improve that area? But it is an area. It is a domain of health.
Yeah,
it's a fun area to work on. Because you can, and the one I like to choose because I don't want to. You've got your audience, and you say, what do I do here? Because we've just put out a lot of ideas.
Sure.
Let's start with gratitude. Because it's again. It sounds easier than it is. People will say, keep a diary or, different sorts of things. Well, first of all, it becomes hard to keep up. You have to work on it. The goal is to develop it as a kind of background way of thinking. But if you play with it and are persistent with it, it starts with, do I really value this enough to work on it? And if you do, and you become more grateful, it makes your life better and it makes your health.
Yeah, I remember hearing years ago, just in this training that I attended. The trainer, I don't know him, but he had shared an exercise that he had done. He and his wife had, I think it was like some couples counseling or a book they read or something like this, something they were just doing to improve their marriage. And he started doing this thing where when he would get home from work, he tended to be very, very grumpy at the end of the day. And so he started looking for something he could say thank you for to his wife and kids, I guess, too. But and he found that when he would get home, he was used to finding the things that irritated him, but he had to hunt. And this kind of goes to what you're saying of trying to gamify something a little bit, right? So he'd look around and say, okay, let me find this. Let me find what can I say thank you for? And he mentioned this one particular day, he comes in and he's in a bad mood. He looks around and the house is a mess. And he's kind of like, okay, here's what I have to do this evening. And I've got all this on my plate. And where the hell is everybody, and kind of thing. And he's already ramping up and he thinks, okay, I got to say thank you for something. Where is everybody? And he kept, he finally notices where they are, and it's his wife is sitting and reading a book with his kids. She got home first before him, and they were sitting and reading a book. And so he said, oh, I should, be grateful that she's sitting and reading with the kids. And then he thought, and all those other things that I was irritated about, if she was doing those, she wouldn't be reading with the kids right now. And if they were all like, if I jumped in and started doing whatever I'm irritated with and whatever right now, then once again, so he was then able to go join them and have that experience. And it sounds like a little thing, but that changes the outlook of a whole evening. That changes the outlook of potentially a whole habit that you're forming or a pattern that you're forming. But how easy it is to just not notice it.
I love that anecdote. I think that's profound. And I think that's exactly the way to approach it. Start with at one area that you can gamify, as you just said. So I like that idea. Mm-hmm. And play with it and be patient with yourself to grow with it, because habits are habits. So getting out of a bad habit in terms of the way you're thinking, it's not so simple. Mm-hmm. So you have to be patient with yourself and just give credence to what I call the power of the first step. See if you can once a day do that. Yeah. And keep that up for a week. Then give yourself a pat on the back that you did that, and keep going with it. Now, clearly, he really took this on, and it just didn't change that. It changed the direction of his life, actually. I think from what.
Yeah, and isn't that interesting? But then, as we're tying it in even more too, then that also shapes a lot more of our lives too. If that is helping, with all these other factors of health that we're having. I wanted to ask you, do you know, with the research on optimism, it's always very intriguing to me. Are you aware of like how do we break that down in a definition? Because I think that's one of the things, of course, is hard to study about these things. But when you do these studies and you see the studies about that, how do we tell if we are optimistic, first of all? And how do we, what's the observable definitions that you've come across with that?
Well, actually, this is an interesting area because it is one area where we actually have a scale called the life orientation test, which has been used now for many years and has become kind of this standard in the field. There's been other ways to measure optimism versus pessimism, like in terms of the explanatory style that you speak in. And Marty Seligman, one of the fathers of positive psychology, developed years ago. But we've gone to this life orientation test, which basically asks people questions in terms of, do they feel that, optimistic about the future, that they expect things to go well or don't go well. And so it's kind of that kind of definition that I have a certain expectancy that things are going to work out for me. So that's optimism. There's a problem with the definition because when you really look at optimism, I believe that what underlies it and is not measured in the scale is the sense that I can handle the things that are on my plate. So it's a sense of self-efficacy, and I think that's important because I think the way to build optimism is work on little optimism before big optimism. First, work on where's an area where I can start to feel more confident that I can be successful in this area. And once you do, you start to feel more confident and you start to feel more optimistic. So I think that more of an emphasis on optimism about, I got to start feeling really optimistic about the future. No. Mm-hmm. Start working on what's a goal that I need to work on that I can, succeed in and build out.
So feeling efficacious or feeling empowered in our own
Yes.
life, kind of a thing. And that's interesting you bring that up, because you can see where if optimism is one of those that can become intertwined with anxiety too, where it's like, because you see that sort of going too far the other direction, where people are completely disengaged from anything that's not positive or doesn't fuel it's going to be fine. It's going to be fine. It's going to be fine. And you're talking more about kind of leaning the other way into saying like, well, I mean, because even sometimes when it's not fine, it's a lot better if I feel like I can probably handle not fine.
Yeah, there's a lot of cross overlap between these different areas of thoughts and emotions and so forth. And that's good because you start to work on one area and it starts to get you into what we call a virtuous cycle in other areas.
Right. Well, and I think it goes back to that idea that there is both this is what I like about your approach is you're embracing the complexity of this issue, but you're also trying to break it down to a simplicity too, of like, these are very complex issues, but let's start with these measurable things and let's start small. And that behavioral piece, which is huge.
That is exactly right. That's like the bullseye. I like what you just said.
What kind of research do you see ongoing that you're excited about in this field? What kinds of things are you hoping that we're asking? Are there new questions we're asking, or things that we need to fine tune our learning on more?
Well, we're talking about the study of life itself. It's very broad, so you have to break it down into individual areas. I think that an example is that we've learned a lot more about how sleep is affecting, us and the mechanics about that. We've learned over the last 15 years or so that sleeping is critical to how the brain gets rid of its waste products. And that during the night, the brain cells actually kind of shrink a little bit. And so the fluid can get out and, get out into eventually the cerebrospinal fluid into excreted through the body and so forth. So that's a very exciting area. I think a really exciting area here is that we have a clarity in terms of how sleep affects us in terms of our moods and feelings, and with exercise and even with resistance training. But now we're looking more and more at how does nutrition work in that way. There's like this whole new field of like nutritional psychiatry. But this is a very hard area to get into. But I think it's a very interesting area because I think people should start to pay more attention to, how do I feel with the diets I have? What affects me? When do I feel more energetic? When do I feel more fatigued? Almost like a self-diary of themselves, and learning what works for them. Because in terms of nutrition, I think the way food affects us is very different for different people. So I think that here the research lags behind what people can do for themselves. And I think people should do that for themselves and pay attention to how they feel, after they eat and so forth. And often that effect is kind of delayed. It's not immediate. But, how do you feel? I remember years ago, I don't know why I did this, but I would come into work early and I would have this bowl of cereal. And then I have another bowl of cereal. And about, 2 hours later, I was like, I was having my lull in the morning, and eventually I cut all of it out. And then, wow, that all went away. So I know that affected me, so.
Yeah.
So,
It's interesting. I know several therapists who do that almost routinely, where they'll have people keep a food journal as well as a mood journal, if you will. I didn't mean to rhyme those, but if you rhyme them, I always say in the at least in the therapy, this is probably true in a lot of medical pursuits. If you can rhyme something or make a cool acronym, you can always charge more for it. But anyway, I know a lot of therapists who will have people track. So what do you eat? And it's like, and if I'm having a crash every day at a certain time. It's funny you just mentioned that, right? Then it's like, oh, that happens within a couple hours of something that I either do or that I consume or something. We see those things. They all really do, end up tying together, and finding little threads we can pull out to disentangle that and use it is very, very good.
Sure.
But, well, very cool, very useful. And I think that it's the kind of thing that people, if we, just like any other medical situations, if we don't think we need this now, we will. And if we don't think we need this now, we probably actually do. So that's the way it is with a lot of any kind of health management. I'm really grateful to to have you share these things with people. I want you to be able to tell everybody where they can follow you online and your work. Of course, right before that, I always like to ask people if they have any guidance for the audience of places that you'd recommend people could put their energy in order to kind of give back to their community. Could be a specific charity or nonprofit that you love, or just a good community practice, or any suggestions for people?
Well, that's a great question. You can look at it in the macro, the micro. I think that the giving is so important, and that we feel so much better when we do give. It is one of those basic psychological needs we have. But I think maybe a good giving thing to think about for 2025 is, can I take on once a day where I'm going to spontaneously, in a way I wouldn't have, given to someone through either a smile or a thank you, maybe someone at the cash register, someone, that I feel comfortable with giving a hug. And just in some way, taking that out, and maybe keeping a little diary of that for the year. Take that on for, my one gift for the day, what you did and how you felt afterwards.
Oh, that's really nice. Yeah.
So I think that would be the way I would think about a charity. In terms of where people can find me, so I have my own website under my name, Rozanski.com. And I'm very active on LinkedIn. So I usually post a couple times a week with different, aspects about health. So LinkedIn's a great place to find and connect with me.
Great. It's alanrozanski.com. And then, of course, on LinkedIn, like you said. Yeah, I've known ever since we got this scheduled, I've noticed that your posts, particularly on LinkedIn, that you've been sharing very, very good stuff that's there. And just like you said, it's cool how you had said earlier that this is a great day that we live in for learning. I think it was when we were talking about resistance training, but in particular, saying, oh boy, there's lots of resources and there's lots of people that know a lot of things and there's lots of information sharing. And it's very cool to have you out there being part of that, and sharing the things that you are, and to be able to talk with you about it today as well. I want to give a quick plug for our highlighted charity of the month. We always like to highlight a local charity as well on the show. And for this month, it's the D Coffee Foundation. That's D, the letter D, and then coffee is spelled Coffey. It's the nonprofit organization set up by Dr. Delise Coffey, who's a athlete and a sports psychologist. She's been on the show a long time ago. We haven't had her on for a little while, but this is her nonprofit that she's put a lot of work into helping students and student athletes to, especially those that are in maybe underprivileged areas, to be able to find scholarships and things through athletics and ongoing education. So you can go to dcoffeefoundation.org to learn more about that, to promote or share the stuff if you like what she's doing there, and even to get involved and donate if you can as well. And to all of those who have chosen to support the Broken Brain by sending us a couple bucks a month or so, as always, this goes for this foundation as well as for all of them. Every time that we have a new member, 50% of their donation will go towards the organization that we were highlighting in the month they joined too. So that's a fun thing. As we just crossed the first of a month recently, I got to send out those little 50% from those of you on the Patreon, and that's a cool gift for me to get to do, and it reminds me of all the charities we've highlighted too. So so thank you for people who are doing that, and hope they enjoy the bonus stuff we're putting out there on the Patreon as well, to get some more fun things happening, as well as more mental health education things going on too. So Dr. Rozanski, thank you again. This is such a pleasure to be able to talk to you.
My pleasure too. Thank you for having me. It's been a lot of fun.
Thank you for listening to the Court and Parts Podcast Network. To listen to more Court and Parts shows, visit courtandarts.com.
No one hates history, they just haven't found the right teacher yet. Or in this case, a nerdy best friend who loves to tell you all about world history, women's history, and weird history. Hi, I'm TK, the creator of For the Love of History podcast, a place for people who want to learn more but don't know where to start, and history lovers who want to break from the mainstream. From rat trials to warrior women, we cover topics from every country and era. Whether you're a history expert or just starting out, there's a place for you here in the Time Machine. So join me every Friday on your favorite podcast platform and YouTube for a brand new topic. See you there. Bye!